Okay, great. Thank you. Hello, everyone. Thank you for joining us today. My name's Lynn Stevens. I am co-president for the Ohio Grandparent Kinship Coalition. We're pleased that you could join us here today. Thank you for taking time out of your busy schedules to be here. We're excited to bring you another uh, topic on the um, regarding children and how may be able to help you as a caregiver as you serve your child, grandchild, niece, nephew, etc. So again, on behalf of our board members who most are here, let's see, we have Ron Browder, our board chair. On the screen here, you see Ms. Brenda Dewberry, our other co-president. Ms. Siobhan Jones is our co-vice president. Ms. Donna Jones is our co-secretary. And of course, everyone knows Ms. Barb Turpin, long time member, and our um, acting secretary at the time. Thank you, caregivers, for being here once again. If you could put your name in the chat, name and email address to be in a drawing for a $50 gift card. We'd appreciate that if you're interested. Again, just your name and email address in the chat there. And Ms. Barb Turpin will pull a name at the end of the meeting. Our next meeting is November 18th with Children's Hospital, and it's a presentation on childhood nutrition. If anyone would like a certificate of attendance for today, please submit your name to Barb Turpin, and she will get you a certificate for attending today if you'd like. So again, put that in the chat maybe as well. And we were going to turn it over to Ms. Brenda Dewberry to introduce our guest speaker. So I will turn it over to you, Ms. Dewberry. Thank you.
Good morning, everyone, and a special welcome to our guest joining us this morning. It is my pleasure to introduce our guest speaker today, Mr. Chris Camboni. Mr. Chris Camboni is an attorney and team leader with Disability Rights Ohio, a nonprofit with a mission to advocate for an equitable Ohio for people with disabilities. Attorney Camboni and his team advocate for increased access to home and community-based services and supports for youth with disabilities. So, Mr. Camboni, welcome, and we look forward to your presentation.
Thank you, Ms. Dewberry. I appreciate it, and I appreciate everybody's time today. I'm going to share my screen here, pull up the PowerPoint. So bear with me just 1 minute. Okay. Can everybody see the PowerPoint?
Yes.
Okay, perfect.
It's not in slide mode yet, but
here we go. Okay.
Thanks.
Okay, so the topic for today is navigating supports and services as a guide for Ohio youth with disability and their families. So really appreciate the opportunity to talk to you all today. Understand that sometimes having youth in our care can be complex, particularly if they have disabilities, and so hoping to provide some information on potential supports and services that may be available for your youth. As Ms. Dewberry mentioned, Disability Rights Ohio is a nonprofit corporation. We have a mission to advocate for an equitable Ohio for people with disabilities. We are Ohio's designated protection and advocacy system and a client assistance program for people with disabilities. These are two different federally funded programs for people with disabilities, and are intended to provide an independent advocate in every state. Every state has at least one. We are the one for Ohio. We are directed by people with disabilities at every level, from our clients to our board. Our website describes our work in greater depth, but generally speaking, we provide legal advocacy and rights protection to a wide range of people with disabilities. This includes assisting individuals with problems such as abuse, neglect, discrimination, access to assistive technology, special education, housing, employment, community integration, voting, and rights protections issues. And I meant to say at the beginning, if you have questions, please feel free to interrupt or put them in the chat. I'll also pause throughout the presentation to see if there are any questions at that point. So to be eligible for our services, the person has to have a disability. We do not have an income requirement, and clients are not charged for our services. You can reach us by contacting our intake department to request help. You can either call one of the phone numbers there on the screen and selecting option 2, or completing an intake form online. Our intake staff typically work from 9 to 12 and from 1 to 4. But if you do have to leave a voicemail, they return the calls pretty quickly. And our clients are the folks with disabilities. So even if a family member calls, we typically take our direction from the person with the disability as much as possible, and wish to speak with them. But feel free to reach out on behalf of yourselves or on behalf of your loved ones. So our annual goals and objectives identify the issues that we work on. We just started fiscal year 2025 at the start of October here, so our goals shifted a little bit, but our goals and, oh, I see a question in the chat here. ADHD, yes, can qualify. Our definition of disability is very broad. We start kind of with the ADA definition of disability, but then expand from there. So ADHD typically does qualify. So our fiscal year 2025 goals and objectives include advocacy for Ohioans with intellectual and developmental disabilities that are experiencing barriers becoming eligible for services in the developmental disability system. And that's for both youth and adult. And we also have advocacy for youth with complex behavioral health needs to advocate for them to access home and community-based services. Over the past several fiscal years, we've been monitoring the implementation of Ohio RISE to ensure that it has adequate capacity for community-based services, particularly for those that are at risk of custody relinquishment, foster care placement, or institutionalization. We advocate to expand and strengthen community services, and we address instances such as abuse, neglect, and exploitation. You can find our goals and objectives for the current year on our website under the Goals tab. So today, we will be talking about what services and supports could be available for children with the following needs: children with developmental disabilities or intellectual disabilities, children with behavioral health needs, and children with mental health needs. I'm going to provide a broad overview of services, eligibility requirements, and how to connect to each resource. And I will leave time for questions at the end, but like I said, please, reach out please throw them in the chat or take yourself off mute if you have questions while I'm talking. So developmental disability is defined by the Ohio Revised Code as a severe and chronic disability characterized by all of the following: mental or physical impairment not caused solely by mental illness. It manifests before age 22, is likely to continue indefinitely, and it results in developmental delays or what they call substantial functional limitations in major life activities. Your substantial functional limitations, it's age dependent on what those look like. And then the final requirement is that care, treatment, or services are needed for an extended period of time. I don't want to get too far into the weeds, but regarding the developmental delays and substantial functional limitations, under 3 years of age, there has to be at least one statutorily defined developmental delay or diagnosis with a high probability of resulting in a developmental delay. So basically, looking to the law, the law will define what those developmental delays or diagnoses are. For children between the ages of 3 years and 6 years, there has to be at least 2 of those defined developmental delays. And then over 6 years of age, there needs to be substantial functional limitation in at least 3 defined major life activities. So there's a whole range of diagnoses that qualify as developmental disabilities. You can see ADHD is on this list. typically, they look for an acceptable diagnosis made by a qualified professional. It's best to document as much as possible and to retain records. It's a little bit easier when the folks are, when you're dealing with youth, and particularly these days where a lot of things are electronic, to maintain those records. We do run into issues with folks that are over age 22, who've moved around a lot, or have kind of gotten lost in the system, or otherwise it's hard to track their records. But to the extent that you can keep those records to help prove that there is a developmental disability, it makes the whole eligibility process a little bit easier. The disability can also include other degenerative or neurological conditions that are often associated with disability. And this list here on this slide is from the Ohio Department of Developmental Disabilities, their Children Ohio Eligibility Determination Instrument, or the COEDI, and the Ohio Eligibility Determination Instrument, or the OEDI. And I'll say that this area is very much just an alphabet soup of abbreviations and everything. So I try to avoid them as much as possible, but sometimes I'll lapse into them. So I talked about this a little bit a few minutes ago, just kind of what the developmental delays and substantial functional limitations look like. For ages 0 through 6, the focus is on developmental delays. For children over 6, need at least 3 of the following 7 areas of functioning. There needs to be a substantial limitation in them. And those areas are mobility, self-care, self-direction, capacity for independent living. For kids that are age 16 and up, economic self-sufficiency. And then for the entire group, learning and receptive and expressive language.
Okay, Chris, this is Barbara. I have a question about this. All right, say for example, one of the identifying conditions has been made, but the individual does not meet 3 of these. So there's not an automatic eligibility for identification of the initial issue, but then it goes into this next step of identifying 3 of the 7 areas.
That's correct. Yeah. So even if someone has a disability, if they don't have the substantial functional limitations, they won't be determined as eligible for services through this system. So yeah, it takes more than just a diagnosis, unfortunately. And they have tools. County boards of developmental disabilities have tools that they use to assess individuals kind of through this process to determine eligibility. So the Developmental Disability Service System is overseen on both state and county levels. The state level, it's the Ohio Department of Developmental Disabilities, or DODD. And on the county level, it's the County Boards of Developmental Disability. The state entity, DODD, identifies its mission as offering support across the lifespan of people with developmental disabilities, and overseeing a statewide system of supportive services that focus on ensuring health and safety, supporting access to community participation, and increasing opportunities for meaningful employment. County boards of developmental disability. Each Ohio county has a designated county board. County boards, among other things, provide assessments, service planning and coordination, and oversight and assistance to service providers. There are 88 counties in Ohio, so there are 88 different county boards. They're supposed to be uniform, but there are sometimes variations based on factors such as funding. The assessments that are done by county boards include assessing whether an individual is eligible for county board services, and can also include assessing for a home and community-based waiver. So on this slide, there is a list of some services that county boards of developmental disabilities can help coordinate. This is not a comprehensive list, and not everyone who is determined to have a developmental disability and to qualify for services would necessarily qualify for each one of these. This is just kind of an idea of what could be out there for folks. Homemaker personal care, which involves trained staff. It often involves trained staff coming into the home and helping with activities of daily living, among other things. Another services, community and residential respite, remote supports, transportation, specialized medical equipment and supplies, assistive technology, environmental accessibility adaptations, and community transition services. So if your youth has a developmental disability, or you believe they have a developmental disability, your next steps would be to contact your local county board and apply. You would contact the county board for the county in which the child lives. You can find a list of all the county boards on DODD's website, or you can often just Google, your county and County Board of Developmental Disabilities, and it'll pull up information. There's an intake line typically that you can call. Some of the county boards, I believe, have kind of online submission processes to get things started, but those would be the next steps if you believe your youth has a developmental disability. Are there any questions before I move on to the next topic? No? Okay. Now I'm going to talk a little bit about youth that need behavioral health services and kind of what services can be available. Ohio Rise is a couple years old now, but it's still a relatively new state program that provides in-home and community-based services for youth who require significant behavioral health supports. Ohio Rise stands for Ohio Resilience Through Integrated Systems and Excellence. One of the things that Ohio Rise is meant to prevent is custody relinquishments, that is families giving up custody just so their child can receive services. One of the stated purposes is to, prevent kind of that institutionalization and custody relinquishment kind of resulting in children being taken from their families. Ohio Rise can be beneficial for youth who have multiple needs that result from behavioral health challenges, have multi-system needs, or are at risk for deeper system involvement, or at risk of out-of-home placement or returning to their families from out-of-home placement. This slide has a list of just some of the services that Ohio Rise covers. Those services include intensive and moderate care coordination, improved intensive home-based treatment, behavioral health respite. There's a primary flex funds that allows up to $1,500 per year to be used on certain things that are defined within the rule. And then MRSS, or Mobile Response and Stabilization Services. And I'll talk a little bit more about MRSS later in this presentation. So to be eligible for Ohio Rise, you have to be between the ages of 0 and 20. You have to be eligible for Ohio Medicaid, either managed care or fee-for-service. And you have to require significant behavioral health treatment needs. And those needs are measured using CANS assessment. CANS stands for the Ohio Child and Adolescent Needs and Strengths. There is also what's called a Medicaid waiver under Ohio Rise that has some additional eligibility requirements. These are intended for youth with the greatest needs, and it provides for home and community-based services such as out-of-home respite, transitional supports and services, secondary flex funds, mental health and substance abuse disorder care, this is under the managed care program, and physical health services and pharmacy coverages, also under the managed care and the fee-for-service programs.
Chris, we do have a question from Jennifer.
Oh.
What do we do if there are no providers through our local, excuse me, through our local Ohio Rise program to service our child? And sort of a piggyback to that, I have a question is, do you have a sense of how Ohio Rise is working for families, given its short lifespan right now?
Sure. Thank you for the questions. Jennifer, I mean, it's an issue that we see a lot is kind of the lack of providers. So that's kind of the next hurdle after folks are able to qualify for services in one of these systems is then providing or then finding the providers to actually provide those services. In those circumstances, we recommend working closely with the Ohio Rise coordinator, or if you're within the DD system, your county board of developmental disability, your services and supports administrator or SSA, to help locate providers. If they're within the developmental disability system, the Department of Developmental Disabilities has regional support teams. DODD has regional support teams that help with some of those issues, but it's unfortunately not an easy solution, and just involves making a lot of calls and a lot of outreach. And then Barbara, I apologize, I forgot your piggyback question.
Oh, it's just sort of an overall question about Ohio Rise. Do you have a sense of, and it sounds like you do, sort of how responsive and effective right now? And I know it's a short-lived, it hasn't been in existence for a while, but some of the barriers or some of the challenges people might be having.
Sure. Yeah. So we've seen some speed bumps as it's been implemented. It's an ambitious program. What we're hearing from families and others that we're talking to is that it's getting better, and that some of those kind of barriers, the lack of providers, kind of the lack of knowledge of Ohio Rise, they're working to resolve those. So, I'm cautiously optimistic that things will continue to get better as the program ages.
We have another comment which might support what you said from Mr. Dimitrakis. They were able to get their 11-year-old grandson, who they have legal custody of, accepted in Ohio Rise, and they have a care coordinator, and the grandson is receiving weekly in-school counseling. There's still challenges with them behavior improvement, but they have been connected and are hopefully getting connected to other supports that are necessary. So that's a positive response to that.
Great. Yeah. Thank you for sharing. I'm glad to hear that. One of the things that we encourage the families that we work with and the youth that we work with is kind of meeting with those care coordinators on a regular basis. If there's multiple systems that are involved, trying to get everybody from the team together at those weekly or bi-weekly meetings to kind of ensure that the youth's needs are being addressed.
And we have another comment from Ms. Roberson that their grandson was able to get into Ohio Rise, and now he's receiving art therapy and more services. So, and it sounds like they had to sort of stay on top of things before this all came about. So I think your point about mainly continue to advocate for your the child is probably one of the best things.
Yeah, absolutely. I'm glad to hear. Yeah, unfortunately, sometimes it does take kind of that constant advocacy, which I know just places another burden on families. But it does oftentimes result in kind of those services and supports. So a little bit more about the Ohio Rise Medicaid waiver. If you have an Ohio Rise waiver, you cannot also have a developmental disability waiver and vice versa. The rules only allow you to have one of those home and community-based service waivers at a time. But even if you have a developmental disability waiver, You can have Ohio Rise non-waiver services. And just a little bit more about the secondary flex fund under this. Services, equipment, or supplies that help a young person with behavioral needs is what that's meant to pay for. And they must be used to decrease the need for other Ohio Medicaid services and to promote the child or youth's opportunities for full inclusion in the community or to increase safety in the home.
Do you have an example of something that might qualify under that category?
Oh, that's a good question. I don't know if I do. Typically, a lot of the clients that we work with have developmental disabilities as opposed to, or a developmental disability waiver as opposed to an Ohio Rise waiver. And the funding under the Ohio Rise waiver is limited. I think it's only $15,000 for a year. So I don't know if I have any examples. I'm trying to think.
Flex funds is 1,500 per year.
So the flex funds under the non-waiver services is $1,500 a year. And then the Ohio Rise waiver has a $15,000 cap for all services under it, whether it's respite or flex funds or transitional support, services and support. So kind of everything else kind of falls in that 15,000.
One of the responses about use of the flex or eligibility for flex funds is it had the items have to be identified in the care plan or in the CANS assessment.
Yeah, and they typically can amend those assessments or redo an assessment if necessary to address kind of what the child's needs are. So even if the team comes together and determines, hey, this would really help this youth a lot, typically they can amend the care plan or have a new assessment done to capture that. But yeah, it needs to be justified essentially to be able to spend those funds. And it's similar in the developmental disability system as well. If they're going to use Medicaid dollars to pay for something, they're going to have some sort of documentation to show that there's a need for that. So how does a child or a youth enroll in Ohio Rise? Most children and youth are enrolled if they're found eligible through the completion of the CANS assessment. If a CANS assessment is done and indicates that the youth is eligible for Ohio Rise, their enrollment is mandatory. A parent can, or a loved one, can request disenrollment for just cause if they don't want the child to be enrolled, but typically they're automatically enrolled. And then CANS assessments can be scheduled with a certified CANS assessor, and there are kind of CANS assessors in a lot of places. Hospitals typically have them. Some of the community service providers are CANS assessors. So if you want to explore Ohio Rise as an option for your youth, your next steps would be to schedule a CANS assessment. And there are some phone numbers on this slide for organizations you can contact for more information on scheduling those CANS assessments. So you don't have to track down the assessor yourself. You can call the Medicaid Consumer Hotline, or you can call Aetna Better Health Ohio to get that CANS assessment scheduled. There's different groups can request to have the CANS assessment scheduled. It can be, providers, managed care partners, community organizations, the youth themselves, family and caregivers can all request that. Once the referral is completed, a CANS assessor in the community will reach out to schedule that CANS assessment. Are there any additional questions or thoughts about Ohio Rise before I move on to the next topic?
If a caregiver feels like for whatever reason the assessment didn't come out the way they felt it should because of what they've experienced with their child, is there a appeals process, or is it just one and done?
You can request to have the assessment looked at. I don't know if there is an appeals process or not on this level of it, but you can request to have the assessment redone to, if you can show like a change in circumstances or you believe that something wasn't adequately captured in it.
Do you
Yeah,
know if, oh, I'm sorry,
oh,
go
I'm
ahead.
sorry, go on. No, go ahead.
No, in this assessment process, do they access medical records and school records and all of that information to make that determination?
You can provide information to them that you want to be provided to them. Typically, the assessor will determine what they want to review as part of the process. But they'll typically interview the youth and often others that know about the child's needs as well. Okay, any other questions or thoughts? Okay. So next, we're going to talk a little bit about mental health services that can be available for youth. This is also set up on a kind of state and county basis. So Ohio has county operated, state supervised system made up of area behavioral health boards. The mental health system's more fragmented than the developmental disability system, and it's not overseen by primarily one entity like Ohio Rise oversees the behavioral health. Mental health is very much kind of a county by county basis. On the state level, you have the Department of Mental Health and Addiction Services, or Ohio MOS. In a county, you have boards that are typically referred to as ADAM-H or ADAM-HS boards. Not every county has an ADAM-H board like that's exclusive to that county. There are several counties that share their mental health board with a neighboring county. Historically, mental health services have been underfunded, and they're often hard to access for youth that carry a serious and persistent mental illness label. So yes, as I mentioned, all 88 counties are covered by an ADAM-H board, but some boards are multi-county in scope. One of the things that ADAM-H boards do is they plan, evaluate, and fund mental health and addiction services locally. If you go to the Ohio Association of County and Behavioral Health Boards, the OACBHA, you can find your local mental health board. And I believe Ohio has 50 county boards. And I think I may have seen a question pop up or a comment. So one of the other resources that's available are.
Oh, I'm sorry, Chris. I was on mute. I was going to read the comment.
Oh, sure, please do.
This is from Mr. Demetrakis. His experience has shown that the navigating process is not that straightforward. He spent a lot of time talking with groups like yours to learn more about and get into get a CANS assessment. He suggests that if someone isn't computer savvy, they'd probably never find the pathway to those services, which is true. I mean, it is, a computer age where all the information you really need is on the computer, and phone numbers don't always get you what you want.
Yeah, absolutely. Which creates a lot of difficulties because most people have access to the internet, but not everybody does. And so it does create additional challenges for folks to try to track down services and to connect with people. So in addition to the mental health, county boards, some additional resources include the 988 Suicide and Crisis Lifeline. This is meant to provide 24/7 free and confidential support for people in distress, as well as prevention and crisis resources. And you can reach 988 by calling 988 or by going online to chat with someone at 988lifeline.org. Other mental health services include MRSS, or Mobile Response Stabilization Services. This is a rapid mobile response, or this is a service that's supposed to be available in all counties, but right now is available in only some counties. It's intended for people who are under 21 and who are experiencing significant behavioral or emotional distress. Assistance can be received within as short a time as 60 minutes. Again, this should be available 24/7. These services include the potential for 42 days of intensive in-home services in connection to ongoing supports, and can include services provided at home, school, the local emergency department, or other community locations. And the interventions are designed to maintain existing living arrangements and then to stabilize behavioral needs. So as opposed to kind of an institutionalization, trying to keep the youth in the home, and then building up the supports around those living arrangements. Services that can be provided by an MRSS team can include safety assessments, de-escalation, peer support, and skill building, among other things. And mrssohio.org provides more information about these services and where they're available. So what counts as an MRSS crisis? It's really any family-defined crisis, including some of the following, but it's not limited to this list: escalating emotional or behavioral issues, addiction and substance abuse, truancy, conflicts between a parent and child or a caregiver and a child, mental health concerns, trauma, including physical and emotional trauma, running away from home, and suicidal ideation. So here are the next steps. If you need additional mental health supports for your youth, you can contact Ohio Mental Health and Addiction Services. You can contact your local county ADAMH board. You can call 988, or you can contact MRSS. And then this slide has some additional mental health resources that are available. Kind of generally, we have Substance Abuse and Mental Health Services Administration, or SAMHSA, NAMI, or the National Alliance on Mental Health. And then there's also some coordinated special care for first episode psychosis. That gets a little into the weeds, but there's some information about that on OMAS's website. And then there are some specific supports as well for youth who are LGBTQIA, including the Trevor Project and the Trans Ohio Care Connect line.
We have another comment from Ms. Roberson. They were able to connect with Ohio RISE quicker through contacting MRSS for behavioral issues.
Okay, great. Yeah, the Ohio RISE, one of the things that is positive about it, has kind of a no wrong door approach. So there are lots of different ways that youth and families can access Ohio RISE. So I'm glad you were able to connect through the MRSS. Okay, you all have been great about offering your stories and questions kind of throughout. Are there any additional questions or things that you want to chat about? My contact information is on the slide here, and then information for our intake department as well. The best way to connect with DRO is to contact our intake department so that we can get, we call them service requests, so we can get a request opened and assigned over to the right team. I see a question about helping with stable accounts. We typically don't provide in-depth help with stable accounts, but what we try to do for everyone that calls us is to provide at least point them in the next, point them in the direction, kind of what the next step is they need to take. Our goals and objectives on our website talk a little bit about the things that we cover, kind of those major issue areas. My team deals with access to the community services and supports. We also do some work with or some work within the carceral system, both youth and adults. But we have like an education team that works with a lot of the IEP issues. We have a short-term assistance team that kind of handles housing issues, among other things. So we do a wide variety of work. I'd encourage you to reach out to our intake department, and they can provide more information about what we can do in a particular instance. But I know just enough of stable accounts to be dangerous, but not anything in depth.
So the reason somebody would contact you is they are having barriers in accessing services, or if services had been identified for that individual as, that individual being eligible, but they're not receiving them, then they would contact your organization to look at what can be done.
Yeah, that may be something that we can help with. For this fiscal year, we're focused within the developmental disability system, at least we're focused on kind of that eligibility piece. So folks that have applied or want to apply for developmental disability services with their county board are having difficulties becoming eligible for kind of Ohio Rise and kind of those complex behavioral health needs. If there are issues with Ohio Rise or with otherwise getting services, I encourage you to reach out to us, and we'll see if there's anything that we can do to help.
Are there eligibility requirements for somebody to be served by your organization?
Our only requirement is that the person have a disability. We don't have income guidelines or anything like that. Just Ohioans with disabilities, so live in Ohio, have a disability, are the essential requirements.
Anybody else have any questions for Chris or want to make any comments about access to what you've experienced in getting access to help or actually receiving help? I think that's always good for other people to hear what either the challenges have been or that you've been successful, and maybe some tips on what you've done in order to, just like Ms. Roberson said, she went through the other avenue to get the services through Ohio Rise. So sometimes it's just word of mouth that helps people get what they need because somebody's already been through the system. So if anybody has any other comments or questions, please provide them. And we have quite a few caregivers on, so maybe it can give them some ideas. Okay. Oh, here's one. Do you assist with establishing legal relationships, custody, anything along those lines?
No, we don't deal with custody issues. That's outside of our expertise. We typically will refer those to either legal aid or to a private attorney.
Mm-hmm. Ms. Robinson said she didn't expect such fast results, and now her grandson's Medicaid card is connected directly to Ohio Rise.
Great.
And let's see, we have some other ones coming in. Miss Adicott says her 2-year-old grandson is in the DD, and my 11-year-old granddaughter is in Ohio Rise, and they have both been a great help to them.
Great, I'm glad to hear.
Great.
One of the challenges that we see is getting the county boards and Ohio Rise to talk to each other and work together. And that's definitely been improving as Ohio Rise, as people are becoming more familiar with it. But we always encourage them to work together to meet the kids' needs.
Right. Well, that's good to know. You're right. It takes a while for something to catch on with people and for them to make that connection with a whole new entity. So this is good to get that word out. Thank you. Anybody else have any comments?
I did want to clarify, you had asked earlier, I think it was you, Barbara, about appeal rights. And if you're determined ineligible for Ohio Rise, it does come with appeal rights to appeal that decision.
Okay. There's another comment, Ms. Loftus. We contacted you. I'm assuming it would be your organization. And because the county denied them a waiver and said that he should have one, should I talk to your office again?
Yeah, I would encourage you to reach out to our office, to our intake department, and see, we can take a look at it and see if there's something we can help with.
And Ms. Taylor in Warren County says her DD has been very helpful with the grandson. It's and in most cases, most government processes for getting a program, eligibility for a program, it's a lot of paperwork to get started, but it is definitely worth it. And that's
It really
usually,
is. Yeah,
yeah,
both those
yeah.
things are true.
Yep. So just be patient if you haven't done it already and you feel like based on Chris's presentation today that you may want to pursue some of these programs, go for it. And then, just be prepared though for a lot of information requests and paperwork and filling out papers and that kind of thing before it, something can happen. So, yeah. Anybody else have any comments, questions? Well, I really want to say, Chris, that this has been informative. We've had different presenters talk about the developmental disability program we've had from the state, but somebody that is really not tied to the state, under the state umbrella, is sometimes good to talk to, because then, the issues you have with that organization, that there might be somebody that can help you. So it's good to get the advocacy information out to families and who to contact. And we will post, Chris is going to provide us with the PowerPoint. We'll post that on our OGCK website, as well as the recording of the meeting will also be accessed through our website too. Probably within a week, all of that will be done and put up on our website. Here are a couple of others. Cuyahoga County DD has resource fairs to help us find providers and services, and that's a good thing. The outreach of these programs is very important because everybody doesn't know how to navigate systems. And so outreach in communities is an important part of the education of caregivers. So, yeah. Any other questions, comments? I want to thank you, Chris, for this very informative presentation, and appreciate you taking out time out of your day to do this. And so
Yeah.
we'll go back to Ms. Dewberry or Ms. Stevens to finish up the agenda.
Okay, I'll go ahead. I think Lynn had to leave. Attorney Camboni, we want to thank you very much for taking time out of your day to share the information on supports and services. I myself have found Ohio Rise to be very beneficial for my nephew. And we just thank you for the time that you've given us today. And I hope that our caregivers will find this information to be informative. Please reach out if you have questions or concerns. And we look forward to seeing you all next month on November the 8th at our next meeting. Have a great day, everyone.
Okay, I've got one more thing to do. We're gonna announce the $50 gift card recipient today. And this is a new person that I don't recognize, having been on our calls before, but we're glad to have her. And we're glad to have, I see several new people, and I'm glad to see that people are coming in and becoming aware of our OGCK, our outreach and advocacy. So it's good to have you all on, all the new ones and all the old guys, the OGs like Yaya and Darlene and Tangi. We've got a group of OGs on here. There you go, Yaya. Hi, good morning. OGs and some newbies. So welcome and thank you all. And we hope to see you at some of the meetings in the future. And our winner today, or not winner, but our recipient today is Donna Adicott. And Donna, I will email you to get information for getting you the $50 gift card, but we certainly appreciate you participating and offering some of your experience that you've had, and everybody else also. So unless I don't see any more, I see a lot of excellent presentations, excellent, a lot of good positive response. So we really appreciate it, Chris. You've done some things, maybe some people or provided information that people didn't have before. So that was our goal.
Yeah, I appreciate the opportunity to speak to you all today. Thank you so much.
Thank you. So unless anybody has any other comments or any information, I think, are we ready to go, Miss Dewberry?
I believe we are.
All right. Everybody have a good day, and